Good afternoon, everyone, and welcome to the California Black Health Network's Health for Life series on mental health. I'm Rhonda Smith, the Executive Director of CBHN, and we thank you all for attending today. The Health for Life series is a new initiative for CBHN that aims to improve the health literacy of Black Californians so that we can all cultivate a more empowered community of individuals who are proactive about their health and well-being and take ownership in doing so. Our session today is on the impact of intergenerational trauma on the mental health and well-being of Black youth. So we're doing this in recognition of Bebe Campbell National Minority Mental Health Awareness Month. And CBHN is launching the Health for Life series on mental health in recognition of that. This month was started because of Bebe's passion and commitment to ensuring that there's greater attention and awareness to individuals whose background and identity can make access to mental health services much more difficult. In May of 2008, the U.S. House of Representatives actually announced and passed a resolution to declare this month as National Minority Mental Health Awareness Month. Bebe Campbell, for those of you who may not be familiar with her, was an author, an advocate, and co-founder of the National Alliance on Mental Health, otherwise known as NAMI, in Los Angeles, and a national spokesperson who passed away in 2006 from cancer. Bebe advocated for mental health education and support among individuals of diverse communities and to end the stigma around mental health in the Black community. So in her honor, I'm pleased to bring this session to you today that focuses on a unique perspective about mental health in our community. Again, the impact of intergenerational trauma on the mental health and well-being of Black youth. And so we'll explore key learnings from our past, how racial trauma plays a role in genetics and how it shows up in our bodies, and the interconnectedness of mental and physical health and well-being, and how that all works together. And we'll explore some healing practices to combat stress and trauma that I'm sure many of us may deal with on a daily basis. But before we begin our conversation today, just to cover a few housekeeping items, the chat box will be available for you to say hello and connect with other people that you recognize on the session today. The chat box is used for posting your questions if you have any questions for any of the speakers or on the topic throughout the duration of the session. So before I introduce the moderator today, just wanted to give a little bit about CBHN, and I see, there's always gremlins working, but I want to talk a little bit about our vision and mission. But our vision is to really create a California where every African-American and Black immigrant has the right to live a life free of violence, stress, racism, and also health inequities. And we do that every day to ensure that every Black person in California is able to live a healthy, long life, regardless of who they love, where they live, how well educated they are, how much money they make, or how they identify, so that everyone has access to quality, equitable, primary, and behavioral health care. And so I'd like to introduce and turn it over to one of our esteemed board members, Dr. Christy Hagans, to take it from here. I'll introduce Christy, and then Christy will give a brief overview to get us grounded today, and then we'll also introduce the amazing speakers that we have lined up to talk about this topic for today.
Rhonda, I'm ready to go ahead and take over.
Sorry, I muted myself too prematurely, but I wanted to introduce you first before you take over. So unless you want to tell who you are, but I can help start that and you can add to that if you like. So I was just about to say, Dr. Christy Hagans is a community healer, African-centered psychologist, consultant, and professor who takes a holistic approach to healing mind, body, spirit, and community. Dr. Hagans is the executive director and founding member of Safe Black Space, a developing nonprofit focused on helping Black people heal and thrive in the face of racism and anti-Blackness. She is an associate professor at California North State University, where she teaches doctoral level psychology courses in advocacy and social justice and facilitating the development of multicultural competency for future psychologists. In addition to the multiple jobs that she has, she provides consultations and trainings and workshops to agencies, organizations, and universities on topics such as Black racial stress, trauma and healing, trauma-informed care with a racial lens, mental health and self-care, among many other topics. And we're so delighted to have Christy moderate for us today. And so without any other delays, I'll turn it over to you, Christy, to get us started for today.
Awesome. Thank you so much, Rhonda. I want to just say thank you just for the invitation to be the moderator for today's session. I am honored and excited about what we have planned for you all. I will assure you it should be exciting, informative, interactive, as well as practical. In addition to being, I think, a healing experience for whomever you are, or however it is that you're tuning in today. We have an amazing lineup of panelists. We are missing one of them. We had anticipated would be here today, but I am sure that we will learn a lot and grow a lot as a result. So with that in mind, I'm going to let you know a little bit about what to expect today, why we're here, and then, as Rhonda mentioned, do a little bit of a grounding before we actually hear from our presenters. So I will allow them to expand on some of the things that I want to bring up today, which is in the interest of really honoring this being Minority Mental Health Month, or BIPOC Mental Health Month, that we want to understand the impact of our lived experiences on our lives. And we know the last 2.5 years in particular have been very, very challenging for all of us, right? When we think about, of course, COVID and the pandemic, one of our presenters is not able to be here because of COVID. I'm actually just tested positive for COVID. We may have experienced those who we love who have suffered, or we've lost them because of the pandemic, right? We've been dealing with racism, this ongoing issue for hundreds of years, really, in terms of our lived experience, but very pronounced and in our face within the last few years, in particular, the last few months, weeks in particular, right? When we consider the killing of Jayland Walker and being shot over 60 times, and of course, the Buffalo shootings just last month, and George Floyd and January 6th, and the on and on and on and on experiences that we have had as Black people. Of course, we have the war in Ukraine, we have gun violence that may be impacting our own cities, we have school shootings. I mean, it's an ongoing list of the traumas that we have been experiencing. And as Black people, so as we think about all of that, but recognizing we're dealing with a dual pandemic, that we are responding, not only to microaggressions, kind of the day-to-day encounters that we experience in our lives, but also the very overt, aggressive anti-Blackness that we experience as well. So today, this particular panel is going to be thinking about, looking at, talking about the intergenerational impact of the trauma that Black people, and particularly our Black youth, are experiencing today. And so thinking about understanding how it shows up in our bodies, how it shows up in terms of our mind, our mental health, our spiritual wellness, as well as having a developing understanding of what do we do about that, and where is it really coming from, and how do we respond in ways that help us to heal and thrive, that are aligned and congruent culturally with who we are, right? Those are some of the things that we'll address today, because we know our mental health and we know our youth have been impacted, again, whether in multiple ways, but whether it's in terms of depression and symptoms associated with that. Of course, and unfortunately, suicide rates have increased tremendously. Experiences of anxiety, of stress, of overwhelm, attempts, unfortunately, sometimes to cope in ways that may be maladaptive. So we see substance use and abuse increasing, right? Addiction as a way where folks may feel as though it's a way to cope, but that can become a real problem down the line. Of course, and unfortunately as well, we've seen violence perhaps in our homes, in our communities, and in terms of large scale wise as well. And so we've got to learn and have a better understanding of what's happening, and how we can respond as individuals, as families, as communities, and as a larger systemic issue. You know, understanding that many of the things that we may be experiencing as people of color, as African-American folks, or people of African ancestry, can be connected to the unfortunate ties and narratives about who we are or who we are not. So we want to challenge that today. We want to invite you to consider some things maybe a little bit more deeply than you have before, and the importance critically of us having these conversations as we consider how we heal our youth, our babies, and ultimately ourselves. So I want to share this quote from Dr. Naeem Akbar, then we'll do a quick rounding, and then we'll hear from our panelists. And what Dr. Akbar says is, when it comes down to it, it's what we do for us that is going to make the difference. We've got to raise our sons and daughters so that they understand the beauty and the power of who they are. So it's that energy in which we will be approaching the conversation today. Before we go any further, though, I do want to take a brief moment to make sure that we ground ourselves, that we presence ourselves in this moment, knowing that the presentations, the speakers, the conversations, the participants, those that might look at this later, that we're all operating really at this larger level of healing. So a part of that is making sure that we're here, that we're present. And so I'm going to invite you, if you are able, to just close your eyes if you feel comfortable. If not, you can remain open and maybe focused on something that you find inspiring. But to allow all the other stuff, right? The things that were going on before you came online, the things that you know you have to take care of afterwards, just to allow yourself to be present so that we can hear what is to come for us in the next 45 minutes or so. But in this next few moments, as we just stop everything else and just breathe into this moment, placing our feet flat on the ground, and breathing consciously. I invite us to give praise and honor to our ancestors, to those who came before us, sending appreciation to the Creator for bringing us here today, and love to the children, our babies, those unborn, our legacy, worthy of the healing, deserving of the healing. So I invite you to take another conscious deep breath and release that. And let's affirm this with me. We know that the ancestors are pleased as we take our rightful place in bringing healing to our people. And we give thanks in advance for the blessings that are to come. And so it is. Ashe, and Ashe means so be it, right on, amen. You can call it what you want, but the idea is we're ready. We're ready to get into it. So let's begin. Ready? All right. I'm going to introduce our first panelist and each person before we move to their time of presentation. And I want to start first by acknowledging and introducing Dr. Cherise Williams. If you have questions or comments, by the way, as we begin, I invite you to go ahead and put those into the chat box or the Q&A feature if that's available, so that we can respond to those once we've heard from all of our presenters. So let me begin, though, with introducing our first panelist, who's Dr. Cherise Williams. She's a licensed psychologist, as well as the assistant director and training director for the University of Washington Counseling Center. She's been with UW for 14 years. And in her tenure, she's helped establish an accredited internship program, as well as provided outreach, therapy, and consultations to the campus community. Dr. Williams has also served as a team clinician for the Seattle Seahawks. And within her work with athletes, she's focused on enhancing performance, developing a winning mindset, and a holistic care approach. And so I'm going to turn it over to Dr. Williams. She is going to talk with you about a number of issues, but in particular, keep your ears open for conversations about microaggressions, around Black youth suicide, around intergenerational trauma, what it looks like and what it feels like. I'm going to turn it over to you, Dr. Williams. Thank you.
Hi, everyone. I am so happy to be here. and to talk to you about something that is very present in the work that I do with my own patients. So first and foremost, I want to acknowledge that a lot is happening in our world. COVID is now in its fifth variant, beyond, Delta. We are continuing to experience tremendous violence in our communities. And so I acknowledge that in some ways, the space that I'm speaking from is one that is hurt and frustrated. And so I want us to not only think about these issues for ourselves and the communities that we serve, but also about how we can start thinking about what are some of the things that we can do to address intergenerational trauma in our own lives. So, what exactly is intergenerational trauma? It is a term that has become increasingly popular over the last few years. Some of you may be familiar with Resmaa Menakem's groundbreaking work, In My Grandmother's Hands, where he talks a lot about intergenerational trauma. So, intergenerational trauma is basically the trauma that is passed through generations. Some of the examples that we have of intergenerational trauma can be witnessed or explored through slavery, through 9/11, and through a research project that happened a few years ago. So I will talk about each one of these things quickly, just so you get a better understanding of what intergenerational trauma looks like and what it can be. So a research project was done a few years ago in which they took a cohort of rats, and what they did is they familiarized them with the scent of cherry blossoms. And then once they became familiar with this scent, they then associated a electrical shock that would be present after they were given the scent of cherry blossoms. So the rats very quickly conditioned to start to experience symptoms of distress when they started to smell the cherry blossoms, because of course the mind and body was able to predict that an electrical shock was going to come after the scent of the cherry blossoms. So after these rats were conditioned, they were then bred. So the interesting aspect of this research project is that the offspring of these rats showed symptoms of distress when they were exposed to the scent of cherry blossoms. So what this means is through their own psychological DNA, they had come to learn through this generational transmission that the scent of cherry blossoms was dangerous. And so, therefore, these future generations of rats continue to experience distressful symptoms when they were exposed to the scent of cherry blossoms. This effect occurred through multiple generations of the original rats. So keep in mind that the generations of rats that were after the original cohort were not given electrical shocks. They were simply exposed to cherry blossoms and the scent of cherry blossoms, and that was enough to impact their systems. And so it's really important for us to remember this, because regardless of how we experience trauma, we can still experience the impact of trauma that we have not had direct experience to through that transmission. The same can be said for children that were impacted by 9/11. And yes, the resource is called My Grandmother's Hands by Resmaa Menakem. And I'll make sure to get that title in the chat at some point. Research has been done about the children of 9/11 that were either in vitro or had been born right after 9/11. And so what they did is they surveyed some of the children that had lost a parent during 9/11. And what they showed was that the children of the deceased parent exhibited higher levels of anxiety than the rest of the population. So despite them not experiencing 9/11 themselves, they were more anxious, and they were having higher levels of distress. So when you think about how does that get transmitted, one example is if you are a parent who lost a partner during 9/11 or lost anyone, when you're walking through New York, you may grab your child's hand tighter. You may talk with them more about protecting themselves. And this has also been exhibited through the offspring of those that lived through the Depression. So even those folks had higher rates of feeling financially insecure, feeling emotional distress. And so I think our biggest example of intergenerational trauma, or one of our biggest examples, is slavery. So because Black people have experienced 400 years of slavery, that's 400 years of intergenerational trauma that has been transmitted into our communities. And so it's really important to recognize that regardless of how much success or how much education or how much safety you may feel in the world, we are all, as Black people, impacted by intergenerational trauma. And that can be as simple as feeling your heart rate increase when a police car pulls up beside you. There was a show that Snoop Dogg was on, and one of the things that he said is that in California, he's basically a legend. And he has a good relationship with many police officers. A lot of the police officers knows that he imbibes marijuana. And he talked very openly about all of the measures that he has in place in order to decrease his contact with the police. And that whenever he is around a police officer, he feels himself becoming anxious or hypervigilant. So one of the things to kind of note is that intergenerational trauma happens when trauma is transmitted through generation, through generation, through generation. And this is also something that we need to be, I think, more present with, is that not only does intergenerational trauma get transmitted through generations, but also resiliency and strength gets transmitted through generations as well. Obviously, this occurred with Africans and Black folks because there's no way we could have survived 400 years of slavery without that. So how does intergenerational trauma show up in Black youth? So physically, one of the things that we sometimes witness is that people will experience stomach aches, headaches, a sense of restlessness, and this level of hypervigilance, which basically means that the Black population, especially in the United States, and the reason why there are so many health issues with Black people in the United States is because our bodies tend to produce more cortisol and stress hormones than other demographics because we perpetually live in a heightened state of hypervigilance. And that is because there is no safety in America for Black people. Again, even thinking of the example of celebrities that still feel impacted by the police or impacted by our awareness that we're not safe in this country, is what is paramount. And so it becomes very important for us to recognize that that living in this perpetual state of hypervigilance means that we're more likely to have digestive issues or more likely to experience stress because, again, we always have a certain amount of cortisol that will be coursing through our bodies because we live in that perpetual sense of non-safety. Mentally, there's a lot of worrying, ruminating, intrusive or anxious thoughts, and just general levels of anxiety that contributes again to our systems being more activated and kind of revved up than other populations. Emotionally, this also contributes to us feeling decentered, dysregulated. So having challenges being able to deal with intense emotions, depression, depressive symptoms, and difficulties relaxing and resting. There are so many Black people that I work with and know that have such a difficult time relaxing and resting. And for me, one of the things that I have started to incorporate in my own practice is ensuring that people understand that rest is revolutionary and that it is white supremacy that causes us to perpetually feel as if we have to be go, 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 because this country runs on white supremacy and runs on a slave mentality. Regardless of how you racially identify, this country, especially its economic structure, is still very much based upon slavery. And so it's very easy to have a slave's mentality of, I must work from sun up to sundown. I must do this. I must do this, because we're taught in this country that we are only worth what we produce and not who we are. And so it becomes very critical in the healing of intergenerational trauma is to confront this slave mentality, which comes from white supremacy, to give us the ability and strength to not treat ourselves like slaves and understand that our ancestors and the power that we resource from them teaches us that it's important to rest. How can we be a part of a revolution if we're tired and weak? And then again, that's the whole purpose of white supremacy. If we're tired, sick, and unaware, then it's harder for us to be a part of the revolution that needs to happen. So all of these symptoms can show up in someone experiencing intergenerational trauma, experiencing racial trauma. One of the things that we're noticing with youth is a significant increase in cyberbullying. And that's because bullying can happen online, especially on social media, 24 hours a day, 7 days a week. There is no respite. And so for children that are experiencing cyberbullying, especially the type that is happening that may be verging on racial violence or microaggressions, it becomes really impactful. One of the things that I am aware of is that that the gaming world is filled with a lot of racial microaggressions and all of these different things. And so what we're experiencing is a higher rate of suicidality among Black youth because, again, there is no ability to find respite. And I think that this is a little bit different, especially with how much remote learning was happening, is that it became insidious. And so bullying has really become something that folks have not been able to escape from. And then when you compare that to the racial violence that youth are also being exposed to, there's a decreased sense of belonging and sense of safety, which is contributing to a higher suicidal rate. And so one of the things that we need to be aware of is that the impact of remote learning is not the best fit for divergent learning styles. People of color tend to, especially Black people, to be social learners and need community. So one of the things that we need to be aware of is how can we start to help youth um, build that sense of community. So I will end very quickly on two things that I feel are really important, which is internal and external resourcing. So in My Grandmother's Hand, they talk a lot about finding ways to resource, and I feel that some of my colleagues will talk about this. But internal resourcing is basically the things that you do internally to help yourself and to Black youth confront intergenerational trauma. So this is including mindfulness, movement, meditative practices that give you the ability to focus on one thing at a time, things that help calm your spirit, like being in nature, and somatic healing. And then the other thing that I will say is the importance of external resourcing, which is relying on the power of your ancestors. I have a corner in my house that's filled with pictures and paintings, Black art of ancestors that came before me, that remind me that I have a lot of strength. So being able to have those visual reminders gives you that sense of ancestral power. And finally, helping one another find community, particularly with Black youth. So I will end there. Thank you so much. And feel free to ask any questions as they come up.
Oh, thank you so much. That was powerful. You packed a lot into that short amount of time. I know I took notes. I'm sure others that are present were as well. And thank you for the invitation and reminder to pose questions. So if you do have questions, please use the Q&A. Once we, again, have gotten through all of our panelists, we'll take some time to make sure that we respond to those if the panelists aren't able to respond to them over the chat box feature. So thank you very much for Dr. Williams. In your place, wherever you are, I want to give her a round of applause, a big thank you. All right. And now we're going to shift, and we are going to hear from our second presenter, our second panelist. Make sure I have my papers here correctly. I think she's going to get pinned, or we will have an opportunity to see her picture as I briefly read bio. And our next presenter is Dr. Theopia Jackson. I am honored to introduce you to Dr. Jackson. She is the chair of the Clinical Psychology degree program at Saybrook University. She's a licensed clinical psychologist who received her master's degree in clinical psychology from Howard University and her doctorate from the Wright Institute in Berkeley, California. Dr. Jackson is the immediate past president of the Association of Black Psychologists, also known as ABPSI, where she served as the principal investigator for the COVID-19 needs assessment among Black communities. She's also the past president of the Bay Area chapter of ABPSI and has held several leadership roles in higher education. She's also, I just said, she's at Saybrook University. And what I will just say in closing is Dr. Jackson relocated recently to Maryland after 30 years of practice in the Bay Area here in California. And so she has multiple responsibilities, including medical privileges at UCSF, Benioff Children's Hospital in Oakland, and also in the Healthy Hearts Program in the Department of Psychiatry and the Comprehensive Sickle Cell Center. So she has a long history, a long connection in working with Black communities, particularly with Black youth, both clinically, and has expertise at kind of the national level working with ABPSI. She is my friend and my sister soror, and I present to you Dr. Jackson.
Thank you so much for that beautiful introduction. I am so pleased and blessed to be in this conversation, in this space. I want to thank the organizers for your vision and also for my esteemed panelists. And my contributions to this conversation today is to take us a little deeper into looking at what does Black mental wellness look like for us from our own centered space and place. And I've chosen to honor it around this idea of this Messiah warrior greeting of Cassandra Ingra, where they meet each other and they say, "And how are the children?" And for those who might be familiar with the Messiah tribe in Africa, they are known for their expertise in warfaring. And I always thought it was a beautiful thing that when they greeted one, that they said, "And how are the children?" We also want to contextualize it from our African ways of thinking and being. Children is not regulated to a chronological age of 0 to 18 or 21, depending on who's deciding in what time. But we are all somebody's children. So as we think about our babies that we've birthed or that we're caring for, those around us, include yourself in that, looking across to one another as we engage in this conversation further. Make sure my slides are awake here. So we're talking about intergenerational trauma. Again, I wanted to put it in this context that this is our African trauma cycle. Many times people will talk about the Holocaust, the Jewish Holocaust, and there's been a number of different types of cultural Holocausts we have had in African. And it's not exclusive to those who have been trafficked here into the United States. We would submit that around the globe, any person of African ancestry has dealt with some form of an African trauma cycle Holocaust. For those here in the States who are direct descendants of those who were trafficked here, we talk about this Mayafa, and we want to thank our dear scholar, Sister Ani, for giving us this contextualization, this conceptualization. In our period of wholeness, when we were self-determined and defining who we were, even though we struggled in our relationships from one tribe to the other, whatever those issues were, they were our problems within our own home, our own cultural context. The intrusion and the trafficking of Black bodies around the world was a trauma that happened to us and has interrupted our, quote, natural, healthy way of being. And so we would talk about being in the space and time of Sankofa, but we need to be very intentional about going back and moving forward that which we do not want to forget. And I hope that becomes clearer to as we move through the conversation. I also like to say that we think about many of the problems that are showing up in our communities today, because we can listen to a litany of problems and we're always going to be at the top of the problem list and barely seen it all on the, quote, doing well list. But I'm not abdicating our unique individual responsibility, but I do want to place it in a cultural context, that these are normal reactions to abnormal situations. You put any group of persons for generations and generations in some of the situations that our communities are having to thrive in spite of, they too would be at the top of everybody's bad list. So I just want to be clear about lifting this up for our folks on the call, that this is not about what's wrong with us as much as it's about what's happening to us. And if we clearly understand what's happening to us, then we can make better decisions in relationship to it. So we're not taking it all in. And that is what feeds the intergenerational trauma. I want to add a quote here that I ran across from one of our cultural scholars who's passed on, our cultural warriors, Tupac Shakur, who said, "If you could walk a mile in my shoes, you'd be crazy too." So when we think about what most of our folk have had to endure, and I want to make sure we include ourselves as professionals, because many of us with these degrees behind our names who are living probably a very different life than how we grew up in, we too have come through some of these same painful doors. So we are not separated from our people. The difference is, I would like to presume, is that we're just in a different location to our levels of awareness and our own activation around healing and wholeness. So if we hold on to this frame, I wanted to arm our people by lifting up the realization that that which we've been saying for many, 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 many years, the American Psychological Association and the American Psychiatric Association are finally, quote, admitting out loud that their systems of healthcare have been grounded in structural racism and perpetuating that. And the way in which it manifests itself is can show up in some of these bullet points here. We hear all the time the over medication of our children, or even the under medication. We hear all the time the criminalizing of our youth when they're dealing with mental health stressors. These, and they're done with the condolences of mental health professionals who've done the evaluations and said, yes, this is what should happen. Now, hear me clearly. I am not throwing it all out. I'm not saying every mental health provider is wrong. What I'm saying is that the medicine, the work that we're starting from, the well has been poisoned. I think of it, a metaphor I thought about is that of a car. You know, you can have all kinds of mechanics who are working on a prime, unique car. And those mechanics can get that car back on the road, but is the car going to run smoothly? It takes a specialist who truly understands that unique type to really keep it running smoothly. Because otherwise, what I submit to you is that much of our mental health services in the United States have fallen short on hitting the actual dis-ease that is the root cause of many of our problems, and that is exposure to ongoing structural racism. I do not need to bring that piece up. I think we're all in agreement with that now, that this is not a post-trauma. This is an ongoing trauma that has just changed its face and its approach in different ways, but it's still coming out of the same place, which is the lie of white superiority and supremacy and the lie of Black inferiority. So I want to lift up the work that was done with the California Reducing Disparities Project, when we said for us, we're not crazy, we're just in crazy systems. And here we're having the system finally admit out loud that it is wrong. It does have its own injustices going. So for the American Psychological Association, they're engaging in something called dismantling racism within their structural systems. But again, they cannot do this on their own. I'm bringing it here to add it to this conversation because as we look at our own psychological healing and liberation, we must understand that the tools that are coming at us are not always the right ones for us. And how do we critically engage a conversation with those mental health providers to make sure they give us what we need? And I'll get to that in a moment, but thank you for holding on for that space. So I wanted to offer this too, because much of what we need has already been lifted up for us by Black scholars. And this is a visual. Of course, I could list each of these, but our people, we're very visual folk. You're being impacted by the names, the faces, the colors, the images that you're seeing right here. It's already getting into your soul and your spirit to see that you should see yourself already. So Black psychologists have been noting this work for a very long time. The challenge has been that in the dominant discourse of who gets trained on what and how they're trained, these voices have been limited. So you have good intended scholars, good intended practitioners, good intended therapists out here who have not been given all the tools to do what they're trying to do, the right tools, and in some cases, they've been intentionally set up to perpetuate us being patients, where our children are forever going to be somebody's client from the time they are, quote, initially diagnosed throughout their lifespan in some kind of a way. That is not good mental health and wellness. As mental health providers, as healers, our benchmark should be, are we able to help shift the quality of life for those who we are working with, not simply reducing their behaviors or setting them up to be more acclimated into a particular setting. So we want to be clear about the work that's happening here too, because I'm asking us to shift our focus and our attention to something called a psycho-spiritual wellness, recognizing that we have been taught by our ancestors that we are spirit beings having a physical experience. It's a reason why we are feeling so much. And when we think about this idea of intergenerational trauma, it's no mistake because we still hold in our DNA, in our spirits, all the pain that has gone before us. I liken this to those times when we all know that when something happens wrong out in the world, we take a deep breath and say, I hope that wasn't a Black person, right? Hope it wasn't an African person. We recognize this when many of our parents grieve at the birth of their Black son. And their grief is because of the protective factor when they realize that somebody someday is going to miss the humanity of their son and instead dismiss them for being something scary and ill. And so we end up raising our children within that fear state. We want to make sure they're doing the right thing so they don't get pulled over. Let me be clear. There's a goodness in that, but that's not the only solution. We must also interrupt the prevalence of them getting pulled over. So when we talk about trauma and we talk about resilience, and we are definitely, as my dear colleague has already said, we are the epitome of resilience because we still stand here in spite of. But at the same time, be careful, because sometimes people are glorifying our resilience. And instead they're instead of focusing on, can we stop what's happening in the community so they don't have to be so resilient? Instead, it's like, oh, look how much they keep enduring. Look how much they keep bouncing back. So we want to shift to thinking about this as a psycho-spiritual wellness, and recognizing that our cultural essence has already given us much of what we need to heal. It's just that we have been distracted from it. Examples of this would be when we think about mindfulness. Mindfulness is not a European Western intervention. It has its roots in many indigenous groups, including Africans. I would submit to you that when you think about what our foreparents went through, and the ways in which they worked on those fields, and the ways in which their bodies hurt, they had to take into some level of mindfulness. They had to be able to leave their bodies to endure the pain. When we think about movement, it is more than just getting into yoga. It is comedic yoga. We were the first. I'm bringing this in because sometimes I think that we have forgotten it. So for example, I want to appreciate my Christian brothers and sisters where they're skeptical of mindfulness. And I think it's because it's being the way in which it's being packaged. And I'm wanting to lift us up and remind us that this was already ours. This is what was erased from our consciousness over those 400 plus years. We were not allowed to have our own language, our own practices, our own beliefs. We must be very intentional to reinvestigate this, reinterrogate it, and see what fits for us now, what we want to claim as our armor in the face of as we're pushing through. This idea of cultural informed practices as we're looking at this is based in this, for me, the realization that we are each other's best medicine. We do not heal well in a self-care, one-on-one individual therapy only. I'm not saying it doesn't have a value, because it does. However, we have too much real cultural science and life experiences to know that I'm going to feel much better when I'm around my people. When I can look into the eyes of my sister friends on this call, my dear sister Christy, no matter how hard my day is, just having her see me sometimes can help me get through one more moment. So in addition to what they call this individual therapy, which I'm trained in and I deliver, and I love the work that my families have helped me to do, I want us to expand it that not everything that is therapy is therapeutic, and not every therapeutic piece is therapy. That we have to be more critical and recognize that we are our own best healers and best medicine. And this means that we should be intentional with our use of language, for example, to be able to say each other's name. Hello, Christy. Say your baby's name. Resist the temptation to call them out of their name when you're angry and upset. You know what I'm speaking to, family. See each other on the street. Eye contact again, lifting each other up, acknowledging one another in the workspace. We all know we have both grown folks and young folks who will be the only two in the room, and everyone else is non-African, and they'll do everything they can not to see one another. These are the types of things that leaves us vulnerable to the trauma. so that when all these things are happening to us, we end up internalizing it, which is the internalized trauma, and start acting from that place. If you tell a child that they're stupid long enough, they will act in kind. If you call someone a bee long enough, they will act in kind. So our tongue is powerful. So as you're being intentional to love up your children, love up the people in your circle and say their name and praise them, let's just say you are spilling onto them one more piece of armor as they deal with what they're having to deal with. Be clear about our rituals. We are a multi-generational, intergenerational people. Our family reunions were some of the most healing places. No matter all the ruckus that goes on, we know at the end of it, it feels good. We have to be intentional to make those happen again. During this period of what some might say is lockdown, we in ABSI say, no, it was not lockdown. It was an opportunity to recenter ourselves and be clear about our values and to how to make sure we are engaging one another safely in social distancing. I offer here too, as well, the work that we've been doing around the emotional emancipation circles, as well as the Sawubona circles. And my colleague will place in the chat room a handout that we have that you can learn more about these resources. I see my sister Chrissy coming on. I have two more and I'm going to move on. Thank you for that spirit here. I just want to leave here too. How do we make mental health work for us? And first and foremost, family, we have to activate ourselves to be good consumers, to claim this space, that they work for us, nothing for us without us. So to move away from, do you have a Black professional, to do you have someone who understands the Black experience in psychology, to be curious with our providers. What is the impact of exposure to structural racism and racial trauma to whatever I'm coming into the office to deal with here? Also, to be intentional, to be our best medicine of being in community and doing community, to be responsible for and to one another, to have courageous healing conversations with our young people, listen to them deeply, not judge, don't try to save, and also model for them, share with them what's working for you when you're having a hard time. Our young people's ability to listen to us and provide for us feeds them as well too. Chrissy, I'm one more after, I'm getting there. Also, when we think about our integrative health, not, as I said, not everything is therapy that's therapeutic, and not every therapy is therapeutic for us. You need to be clear about this. And lastly, I would say, enter into the world of mental health, become the providers, because there needs to be more of us to shift it to make it right for all of us. And I leave you with this quote, this proverb, as we started out here, that a child who is not embraced by the village will burn it down to feel its warmth. And we are all somebody's children. We are our ancestors' best answer. Thank you for this moment and opportunity. That time went by really fast.
It always does, doesn't it? Thank you so much for that, Dr. Jackson. What, again, an insightful, informative, deeply moving and touching place and information that you shared. You got a lot of love in the chat. And so thank you for that. I'm going to keep us moving so that we can hear from our final panelists and then really get into a few more dialogue and discussions. Things just continue to get better and better. So I am confident that we will have yet another powerful presentation and conversation by our sister here, LaShawn Francis. So let me tell you a little bit about Miss Francis. LaShawn, prior to joining Children Now, she was an associate director at the California Medical Association. She provided policy support and analysis for California physicians on the issues of Medi-Cal, workers' comp, and health information technology. LaShawn spent over 2 years with the Legislative Analyst Office, or LAO, where she provided fiscal and policy analysis to the state legislature on issues of mental health, developmental disabilities, and alcohol and drug programs. In Washington, D.C., She worked as a program analyst for the U.S. Department of Education, providing fiscal support on issues of higher education. So we're going to have an opportunity now to hear from LaShawn. She's going to talk with us a little bit more specifically now about ACEs. And if you're not familiar with ACEs, you'll have an opportunity to learn a little bit more about them, and particularly in terms of their impact on Black youth, and what we're doing here in California to address some of those issues within our Black community. So I'm going to go ahead and turn it on over to you. Let's go.
Thank you so much, Christy, and thank you, everyone. I'm not sure if my slides are able to be reflected at this moment, but I'm really thrilled to be here, and I'm excited to talk a little bit about what is the state of California doing to respond to the needs of Black youth. We've had two dynamic presenters before me talk about the need and talk about what's currently happening. But what I'd like to really delve into is what has been the policy response, and why policy? Why am I even doing this work, right? And the answer is actually quite simple for me. We live in a society, in a world where our government has the ability to either invest in us so that our communities can thrive, or disinvest in us so that our communities fail, right? And I think for the most part, we have a long history and contentious history with government, with policy initiatives, with programs. Some have been positive, but I think most of us can point out the harmful practices that have been done over the years, particularly within the Black community. So I really want to take a moment to look at, what are we talking about here? What initiatives are the state thinking through when they hear about our suicide rate, when they hear about intergenerational trauma? What are they doing about it? And just so you know, my slides went down. Next slide. What are they doing about it? And I read somewhere, and I don't know how true this is, that there are currently over $10 billion of children's mental health initiatives happening at the state level within the last 2 years. I don't know if that number is accurate, but I did think it was interesting. And these are some of them. The ones that I'm going to focus on today are the ones that probably got the most attention in the media, in community spaces where policy programs and statewide initiatives are being focused on. And the first one I'll talk about is the ACEs Aware program. And many of you might be familiar with ACEs Aware. We had our first California Surgeon General, Dr. Nadine Burke-Harris, who really introduced this program. But the interesting thing about ACEs Aware, and this is the initiative that essentially says we should be screening Medi-Cal patients primarily in the beginning for trauma. And I remember that there was just a lot of discussion about this, but I will say, someone who was there from the beginning of the conversation, a little bit of background on how this happened was that there were advocates, child welfare advocates, who said, it's not fair and it's not right that our young people who are part of the child welfare system have to get a diagnosis before they're able to get treatment. The simple fact that they've been ripped from their homes should allow them to get mental health support and treatment. And there was a contingent of providers, particularly at the Children's Hospital Oakland at the time, who said, we've actually been working on a project that specifically looks at the way trauma shows up in children's bodies. So not quite the mental health angle, but what they were saying was, we've seen 10-year-olds with high blood pressure, for example, and we want to know why. What has happened to this 10-year-old that their body is reacting that way? Dr. Jackson talked a lot about how trauma is showing up. Sharice talked a lot about intergenerational trauma, so I don't have to go through the science of it, but a lot of things that were really almost obvious to us in the community, right? Because I think for those of us who have lived our lives, we might not have the scientific language to really understand what's going on with our youth. But for us, it wasn't surprising to hear that our young people had physical ailments and outcomes, and their environment was what was causing those physical ailments. So that's essentially why these pediatricians got together and they created a tool called the Pediatric ACEs and Life Events Screener. And this screener is about 15 to 20 questions, I can't remember. But the interesting thing about it is it has a portion on it, and this portion is the new portion, and that asks a few questions. Have you been exposed to community violence? Have you been discriminated against or felt that you were discriminated against due to things like your race? Are you food insecure? Do you have access to food? Things that we don't necessarily traditionally define in the medical field as being traumatic, pediatricians suddenly wanted to know more about and wanted to understand, right? So if they are seeing that a child has low calcium levels, maybe they're food insecure, right? Maybe the answer isn't just to scold mom and dad and say how you aren't feeding your children a balanced diet and you need to give them better food. Maybe it's to find out, what is the food situation? Do you have enough food to eat, or do you have good food to eat, right? Has a child ever been separated from their parent or caregiver due to foster care or immigration? That is a very unique question, right? So we are looking at a time where it feels as if pediatricians are catching up to the things that we've known in our bones and the things that we've known in our bodies and our spirits and our minds. I'll leave that to you to decide whether or not it's a good or bad thing, but that's where it came from. Dr. Jackson did mention that therapy oftentimes doesn't work when we only focus on the child. We have to focus on some intergenerational approaches. So the interesting thing about the ACEs Aware program and the screening program is they aren't asking these questions, the same questions of parents. They're asking parents some really run-of-the-mill questions about whether or not their parents were divorced, et cetera. But those questions about exposure to community violence, exposure to racism and discrimination, separation from parent and caregiver as a child, they're not asking parents those questions. So you can already imagine the issues that might bring up if you really are trying to approach therapy and approach healing from an intergenerational standpoint. So that's one example of something the state is investing in right now. Hundreds of millions of dollars has gone into it. I will just say that my organization at Children Now, we really didn't love the fact that this was just for Medi-Cal patients. We thought it was pathologizing the poor, really saying that for some reason only the poor should be asked these questions. We didn't think that was something that, one, was even scientifically accurate. And so we actually went back to the state and asked them to expand the screening into private insurance as well. And the governor did sign that last year, and we're still working to roll that out. So that's a little bit of update on that. The other thing that I did want to flag for folks is I did mention that some young people had to get a diagnosis first in order to get treatment. And you can see why that's a problem. If we are talking about our Black youth and our brown youth who are seeing things in their communities that might not be healthy, or they're experiencing things online that might not be healthy, that does not necessarily rise to a diagnosable level. And we don't want to wait till children are in crisis mode in order to respond. So what the state is doing within CalAIM, really at the behest of a lot of stakeholders like our organization, is to implement a system that allows young people to get care without needing to get a diagnosis first. That's something that is supposed to be rolled out pretty quickly. It's not quite realized as yet, but that is something the state is open to doing and is willing to do at the moment. And then investments in school-based health. There are billions of dollars right now being invested in community schools. I know LA County is really invested in the community school model, and that model is really supposed to center children and family and their needs, and not just assume that educational attainment can be realized in a vacuum, right? But it's supposed to provide these broader supports and wraparound services for families, for youth. So that's one thing that we're doing. Children Now did go to the state this year and say, look, our Black suicide rate is through the roof. It has actually increased 28% since 2019. You need to do something specific for Black youth. Generally, when the state makes investments, they are blanket investments in either an age group like K through 12 or an insurance type like Medi-Cal versus commercial. And we said, you need to invest in suicide prevention for Black youth. And they said, okay. And I think about $90 million was dedicated for suicide prevention efforts, and they specifically said Black communities, Latino communities, and Native American communities were to benefit from this. So we're going to be working with the state to make sure that that money gets out into the community. That's a high level about what they're doing. I'd like to talk a little bit though about what might they also be able to do. Next slide. So what if, in addition to everything that I talked about, right, that might really sound great to you, but what if we had an acknowledgement of harmful systems, right? My predecessors on this panel talked about the fact that oftentimes what we're seeing is state-sanctioned trauma, right? And so there does seem to be this disconnect, and particularly in the medical community, that we're going to ask you about your trauma, but we're not going to acknowledge at all how we've played a role in traumatizing you. That's really unacceptable, right? So an acknowledgement of harmful systems is really important. And not just an acknowledgement of harmful systems, but also stopping the activities that cause harm. That's something that I talk to state policymakers about a lot. What if we actually stopped doing the things that caused harm? For example, young people have been calling for a very long time to remove police from school campus. They're saying this actually increases our chance of interacting with the criminal justice system. It increases our trauma by having to interact with police on campus, particularly when we don't have counselors on campus. So what if we stopped doing that practice, right? Then there's investment in root cause prevention. Okay, so root cause prevention, what does that mean? What that means, we need to invest in things that stop things like community violence, that stop the discriminatory practices that harm us, right? That stop domestic violence. There are whole volumes in public health research on how to invest in these things. What if that's where the state took their billions of dollars? And then investment in whole child and whole families. I asked somebody the other day, what was radical to you about government investment? And they said very plainly, free healthcare, free childcare, 8 weeks PTO, and all of these things that we've been conditioned to believe can only exist in Europe or only exist in Canada, right? But we are living in a very resource-rich state. We can create a reality where we're investing in whole child and whole families, and we're not making it a burden to simply exist. And then finally, what if it's youth-led and family-led? One of my favorite things to do is talk to young people about what it is they need and not assume as the adults in the room that we know what's best. So what happens when we center youth voice? And what happens when we work with families to center youth voice? What programs would that look like? I do remember being in a session with young people just listening. And one thing that they said to me was, one thing that helps us with our feelings and our emotional state is art, but we've disinvested from art programs in schools. So what happens if we didn't necessarily always look to the clinical model on how to answer some of these problems? If young people are telling us that investments in the arts could really help them, why aren't we doing more of that? So I'll stop there and just leave you with that. I'm here for questions, and I hope, Christy, that I did not run over my time.
Oh, you were right on time. I was about to give you the axe, but I knew you're wrapping up. So thank you so much for that, LaShawn. You as well. I see there's a lot of chatter in the chat box and comments. And so big thank you for all of the nuggets, all the wisdom that you have shared with us, and bringing a very unique perspective and introduction into how we can think about it for our youth. And kind of some of as you were speaking about the policy pieces, legislative pieces, and practical things that need to be happening as well. So thank you. Let's give her a round of applause as well. And we've moved into the last kind of segment. Thank you of our panel, of our presentation today. I'm going to make a couple of comments, and then what I'm going to do is really invite us to take a look, and I will take a look at the Q&A and any chats that may have come up that we haven't yet responded to. But I wanted to just comment on some of the standouts that I heard from each of you, and thank you for that. This idea of state-sanctioned trauma and harmful systems, of what you just spoke about was like, yes, right, what is happening and how can the state everywhere, but knowing right here, right where we are, how can we focus on creating and stopping those activities that create harm? I love the examples that you gave, real very specific opportunities for that. And the idea of the screening tool and some of the tweaks that are happening, it's amazing to think about what can and will change at the ways in which the questions are being asked or considered, or you all and your agency is pushing for things to shift and change. So thank you for that. I want to also move back, just go back in time a little bit and make some comments related to Dr. Jackson. I consistently quote her alluding to the comment that she spoke about at the end about not everything that is therapeutic, not everything that happens in therapy is therapeutic, and not everything that has to be therapeutic happens in therapy, that there are other ways that we heal, and the idea of being very intentional of our languaging and breaking it down in that last couple slides of, again, being very practical. What are the steps that we need to take? I loved your introduction of the concept of psycho-spiritual wellness and collective healing, and the importance of that in terms of understanding, again, our history. And you said something, I was like, oh, really got me around that, all of this stuff, the mindfulness, comedic yoga, that it was ours, but it's been erased. And so I don't know about for you all, but there are certain things that just my spirit, my soul just kind of reacts and just knows like this is right and well. So thank you for reminding us of that, and how APA and APA have begun to acknowledge explicitly the roles that they have played. And then of course, Dr. Williams just really started us out with very powerfully thinking about what is intergenerational trauma anyway. The examples that you gave, that you cited, for me really stuck. The ones with the cherry blossoms and the scent and the smell and the rats, and like, oh my gosh, how real is that for an understanding of what that means for our history and our stories, while also I understand and really want to highlight and recognize what you said about our resilience as well. So yes, we've carried that trauma, but guess what? We also hold on to that strength. And we want to be careful, as Dr. Jackson said, that doesn't begin to be exploited on the other side. So this has been powerful. I'm going to take a pause though, and I'm going to see if there's any questions. As I move to that, I want to invite any of the panelists. Is there anything that someone said that you were like, oh my gosh, I need to hop on that. I need to co-sign on what my sister over there said, or anything that you might want to offer as I prepare to bring any questions in from the audience?
Well, I will start. I thought I was going to jump up and do a dance when my sister said, you know, state-sanctioned trauma, because that just epitomizes it all, that through the regulations and their measurements and their decision-making process, that many times is completely disconnected from what our people really need in the room, on the ground. And I offer that example that in mental health practices, many times, the way that you are compensated for group therapy versus individual therapy, an agency can't survive. So they are forced to do more individual therapy, even though they know group may be more beneficial because of how the funding is set up. And even when we present that clear data to the state, to Alameda County, they saw it for themselves. It did not change the funding structure. So there's ways that the system is built up that causes more harm than good. Thank you.
I thought I saw you itching to speak. Any of the other presenters want to share anything before I move to the other items?
I just wanted to kind of quickly talk about liberation psychology. and some of the transformational, intergenerational healing work that I've been doing. Because I feel like one of the questions that we got is like, how do we then move from this existence of surviving to thriving? And it really is about finding joy in the existence of being Black, not only for ourselves, but helping youth do that as well. And so it's really about surrounding yourself with positive imagery of Black folks, you know, in art, film, television, in writing. Dr. Jackson shared so many wonderful resources that have been created for us by us. And so I think that when we start to make intentional efforts to make our Black lives matter, regardless of what society is reflecting back to us, that is when we start to thrive. That is when we start to go beyond surviving. When we start to dismantle our internalized slave mentality that tells us that we need to work from sun up to sundown in order to be considered worthy citizens, then that is how we start to dismantle intergenerational trauma and really start going through healing. My ancestors died for me not to work myself as a slave. And so slavery continues for us if we do not break from the mental trappings of slavery that is still imprisoning our people. And it's really hard to do that, which is why we need to practice the skill of discernment, which tells us when we need to code switch. And it tells us when we do need to be more productive or produce more so than our white counterparts. But that's not always the case. And we also need to start having systems show up for us so that we don't have to do more than other demographics in order to be seen as valuable and worthy. And so again, it really starts with us being able to dismantle our own internalized slave mentality that then will give us the energy and the courage to start dismantling systems. That is the pathway to true liberation. Because if I'm waiting for white people to free me, I will never be fucking free. Sorry, that's just the truth. So.
Yes, sister speaking true. Thank you for that. And what a great opportunity to go into one of the questions that was asked. There are some that are in the Q&A box, but that just follows up one that was asked by other folks. So if Dr. Jackson or Ms. Francis want to speak to the question around, you know, how do we survive? How do we not just survive, but thrive if we're all experiencing intergenerational trauma? How do we heal? Is there more you'd like to add to that question? And then there's a couple others that have come up.
Yes, everything our sister said, and yet I think we would be remiss if we did not pay close attention to the internalized racism. That too is what keeps it going. Biko said, the best weapon of the oppressor is the mind of the oppressee. So when we see our children out in the street and their pants are baggy, we're afraid of them. That's part of that internalized racism. When our children are afraid of themselves, when they're placing themselves in harm's risk, when they are caring less about their own body as they're putting themselves out. And let's be clear, this idea of suicide happens in multiple ways for our children. It is suicide by cop. It is suicide being involved in a gang. There's something that happens where they're playing less about their own spiritual, physical well-being because the pain of where they are hurts so much that going anywhere else looks like it's better. So we in our own community must also counter that. And as I said, and the way we counter that is that we have to remember we are each other's keeper. These are my children. We have to go back to that space and time that if I see somebody's baby hurting, honey, is everything okay? Where's your mommy? Being there for one another. We have to be sister mommies to one another. Yes, there's a fine line between that's their child, but be careful with that too, because it's also our child. So sometimes that mama needs a little bit more love so she can do right by that child versus us sitting in our house talking about her and letting her suffer in silence right next door to us. How do we also get involved, like using the emotional emancipation circles that are designed to kind of help activate communities to be their own community again? And that activation goes into the psychological liberation, as Sister Cherise said, into the activation of claiming back our own communities.
Right. That's right. Thank you, Dr. Jackson. Ms. Francis, did you want to respond to that as well? Shaking of your head. All right. Our other folks have covered it well.
There's nothing else to add.
There's one more thing I do want to add that came out of the earlier conversation, again, about this use of language. And Sister Christy, you'll know, because I usually say this everywhere I go. I want to ask us to work very hard to let go of the term at-risk youth. Because think about it psychologically. That's placing the problem in the youth. It means, let me just go fix this youth. And instead, what happens if we say at-risk youth, at potential youth in at-risk environments? It makes you say, what's happening to that child? What's happening around that child? Because sometimes that's what needs to be massaged and fixed so that child can do more better. I also ask us to be critical about the use of the term minority. Psychological, the psychology behind that is it means less than something. So why is it that there's certain groups that are wearing a banner, minority so-and-so, and there's nobody walking around saying majority so-and-so? So again, just being careful about the use of language, the power of our tongue, naming where the intervention needs to go. Our children are at potential and at-risk environments and situations. Stop leaving our mamas and papas and families in the waiting room, and hold the system accountable for making sure if a child is in mental health services, what services are being provided to the family and the community that's holding that child. If it takes a village to raise a child, what does it mean when the village is hurting? Heal the village that's raising the child.
What a wonderful concluding statement. Thank you for that, Dr. Jackson. I want to thank all of our panelists for what they brought to the table, the healing, the knowledge, information that I know I received. I'm sure we all did. And at this point, I'm going to turn it back over to our main host of the event today, which is Rhonda Smith from CBHN, and then we're going to close out. So
thank you, Christy. Thank you, LaShawn. Thank you, Ethiopia. Thank you, Cherise. I expected this to be a really powerful conversation today, just based on the huddle we had last week. And I know for me that it exceeded my expectations. And I want to thank you from the bottom of my heart for sharing your words, and words that, just based on the comments in the chat, that people really needed to hear, and validated a lot of things that I think some of us experience on a day-to-day basis or have encountered in our lives. And I usually close with some things about CBHN, but today I'm compelled just to end in a way that hopefully can really tap into our souls and our spirit. And so I want to turn it over to Ethiopia to introduce the video that she shared with us when we were getting prepared for today, because I think that is the perfect way to end and really have us embrace and love ourselves and give ourselves the hug that we need, right, to get through the rest of the day and the rest of the week. So thank you very much.
Okay, thank you for that. And I wanted to share this closing video and ask you to take in the words, take in the rhythm, the musicality, the images of our babies, because we've talked about some heavy stuff here today in terms of intergenerational trauma. But we're being reminded once again that our lifeline is in our babies. So enjoy. And just give me a thumbs up when this music comes on, everybody can hear it. I'm looking at you particularly, Cherise.
Yep, we hear it.
I've been walking with my face turned to the sun. Weight on my shoulders, a bullet in my gun. Oh, I got eyes in the back of my head, just in case I have to run. I do what I can when I can, while I can for my people. While the clouds roll back and the stars fill the night, that's when I'm gonna stand up, take my people with me. Together we are going to a brand new home, far across the river. Can you hear freedom calling, calling me to answer? Gonna keep on keeping on. I can feel it in my bones. Early in the morning, before the sun begins to shine, we're gonna start moving towards that separating line. I'm wading through muddy waters. You know I got a made up mind, and I don't mind if I lose any blood on the way to salvation. And I fight with the strength that I got until I die. So I'm gonna stand up, take my people with me. Together we are going to a brand new home, far across the river. Can you hear freedom calling, calling me to answer? Gonna keep on keeping on. And I know what's around the bend might be hard to face 'cause I'm alone, and I just might fail, but Lord knows I'll try. Just as fill up the sky. Stand up, take my people with me. Together we are going to a brand new home, far across the river. Can you hear freedom calling, calling me to answer? Gonna keep on keeping on. I'm gonna stand up, take my people with me. Together we are going to a brand new home, far across the river. Do you hear freedom calling, calling me to answer? Gonna keep on keeping on. I'm gonna stand up, take my people with me. Together we are going to a brand new home, far across the river. I hear freedom calling, calling me to answer. Gonna keep on keeping on. I can feel it in my bones. I go to prepare a place for you. I go to prepare a place for you. I go to prepare a place for you. I go to prepare a place for you.
So thank you, Ethiopia. Someone asked about where they can find the video. So you can-
Yeah, it's on the YouTube. I'll put it in here for you real quick. My apologies.
no worries. It was, I think, the perfect way to end today, and very powerful to listen to the words of the song and then see the movement, right? Being connected to the music and the message. And I think this is a perfect, add on to the session we did on June 28th about Black music and movement and the power to heal. And I think we saw that illustrated in the video that you showed. So thank you for sharing that with all of us. And again, thank all of you for being here today and dropping all the powerful nuggets that you did and for taking time out of your busy day. And Christy, I appreciate you showing up, even though I know you weren't 100%, but really do appreciate it and love you guys. And thank you so much. Have a great afternoon.